Hi everyone! Welcome to episode 5 of the Two Hands, One Heart Life Skill Series. I am Jordan Welker, Miss Roanoke Valley's Outstanding Teen 2020. If you have not watched episodes 1 through 4, please watch those first to be able to accurately follow along with the series. Again, I want to reiterate that I am an American Red Cross licensed CPR, AED, and First Aid instructor, and this online series is not a formal certification course. My intent behind these videos is to give you a skill to practice and learn if you are in a situation where you may need to use this knowledge. Our topic for episode 5 is heart attacks. Today's episode will cover what a heart attack is, what the signs and symptoms are, and how to care for a person experiencing a heart attack. A heart attack occurs when blood flow to part of the heart muscle is blocked because the cells in the area are not receiving the oxygen and nutrients they need. They die, causing permanent damage to the heart muscle. Seeking advanced medical care as soon as the signs and symptoms of a heart attack are recognized can minimize damage to the heart and may save the person's life. So, what are the signs and symptoms of a heart attack? Chest pain, discomfort, pressure, or squeezing that lasts longer than 3 to 5 minutes and is not relieved by resting, changing position, or taking medication, or that goes away and comes back. Discomfort or pain that spreads to one or both arms, the back, the shoulder, the neck, the jaw, or the upper part of the stomach. Dizziness or lightheadedness, trouble breathing, including noisy breathing, shortness of breath, and breathing that is faster than normal. Nausea or vomiting, pale or ashen gray skin, sweating, a feeling of anxiety or impending doom, extreme fatigue, and unresponsiveness. Individuals may experience heart attack signs and symptoms differently, and not everyone will have the same sign or symptom. Even people who have had a heart attack before may not experience the same signs and symptoms if they have a second heart attack. Biologically, men often have the classic signs and symptoms of a heart attack, such as chest pain that radiates down one arm, whereas women often have more subtle signs and symptoms. In women, chest pain or discomfort may be milder and/or accompanied by more general signs and symptoms, such as shortness of breath, nausea or vomiting, extreme fatigue and dizziness, or lightheadedness. Because these signs and symptoms are so general and nonspecific, women may experience them for hours, days, or even weeks leading up to the heart attack, but dismiss them as nothing out of the ordinary. Signs and symptoms of a heart attack may also be more subtle in people with certain medical conditions, such as diabetes. If you think someone is having a heart attack, act promptly. You should call 911 or the designated emergency number immediately. Be prepared to give CPR and use an AED if the person becomes unresponsive and stops breathing. If you are trained in giving CPR and using an AED, help the person to rest in a comfortable position and loosen any tight clothing. Many people might find it easier to breathe when sitting. If the person takes a prescribed medication for chest pain, offer to get the medication for the person and assist him or her with taking it. Reassure the person and monitor their condition until EMS personnel arrive and take over. Aspirin helps to prevent blood clotting and can be effective when given soon after a person experiences signs and symptoms of a heart attack. However, other types of pain relief medications, such as acetaminophen, are not effective for a person who is experiencing a heart attack. Aspirin-containing combination products meant to relieve multiple conditions are also not effective for a person who is experiencing a heart attack. Do not delay calling 911 or the designated emergency number to look for or offer aspirin. Only offer aspirin if the person is responsive, able to chew and swallow, and can have aspirin. Thank you so much for watching this week's episode of the Two Hands, One Heart Life Skills Series. As always, I hope you learned something new, and if you have any questions, please comment or send me a private message. I'm excited to see you next week for another brand new episode. Stay safe and save lives!